All right, so the first movement we're going to cover today is shoulder flexion. And we're going to go over some of the most effective hand holding techniques, talk about body positioning so that you can protect yourself, not only as the one doing the stretching, but also for your patient, your family member, your friend, whoever you're working with during this process. So we're going to go over hand holding technique. We're going to go over what some of the most effective rate of speed is, as well as some potential both verbal and physical cueing that you can provide to your patient in order to make sure that they feel comfortable and that you're getting the most out of your partner assisted stretching. So like I said, first motion we're going to do is shoulder flexion. Super important to be able to reach up and overhead into cabinets, grab things out, into the closet to be able to reach up and grab that favorite coat, favorite pair of pants, as well as for our gym goers, people that are wanting to get back into doing things like push pressing or even handstands. So in order to get into position to make sure that you, again, protect yourself as the person doing the stretching, as well as making sure that the patient or your friend or family member feels comfortable, is that you want to get as close to the table as physically possible. And then you're going to have your friend or family member actually scoot over as far as they can towards the side of the table that you're on, just so you don't have to lean over quite as far in order to get into position to support their arm. So now that your friend or family member is in position, you're going to get down into a little bit of a squat, a little bit wider with your feet's going to make you a little bit more stable there. And then you're just going to come up and underneath their elbow and kind of cradle that with the arm that's away from the head of the patient, friend or family member. So once you're in that position, your top arm is going to be just kind of gently locked around their wrist, and then your bottom arm is going to be supporting underneath their elbow. So once you're there, you can just kind of stand back up out of that little bit of a squat position, and now you have a good support of their arm against your body and against your chest, which is going to allow them to relax a little bit more. So from here, I like to switch my arm that's away from the head of the patient to where now the hand is going to be facing and the fingers are going to be facing up towards their head. And this is just going to help us to be able to direct the shoulder in the direction that we want it to go from there. So I like to be able to, with each one of these motions, do a little bit of a rocking motion. And that is going to allow you to ease a little bit further gradually overhead. And it's also going to allow their muscles around their joint to relax as fully as possible. So just over the course of 20-30 seconds, starting to gradually work a little bit further and further, doing a little bit of kind of back and forth until you work up to the point where that shoulder gets a little bit tight, a little bit stiff, might be a little bit sore for your friend or family member, and you're just going to kind of hang out there and maybe stretch for a minute or two. As you get further along in that minute or two, you should be able to kind of gradually go a little bit further into that range. Okay. Good, and then we're going to start to work our way back down. Reposition that hand that's furthest away from their head. And then very gently bring that arm back down onto the table or support it across their belly form.